Have you ever stopped to wonder why infection control is so critical in healthcare settings? It's not just about keeping the environment clean, it's a comprehensive approach that safeguards the health of both patients and healthcare workers. Today, we're going to explore the key components of infection control and shed light on each one in detail. First on the list is hand hygiene. It's not just about cleaning your hands, it's about doing it right and at the right times. Rigorous hand washing with soap and water or the use of alcohol-based hand sanitizers can effectively prevent the spread of infections. Remember, clean hands save lives. Next up is the use of personal protective equipment, often referred to as PPE. This includes items like gloves, masks, gowns, and eye protection. These items act as a barrier, protecting healthcare workers and patients from exposure to infectious agents. Then we have environmental cleaning. This involves the regular cleaning and disinfection of patient care areas, equipment, and high-touch surfaces. By keeping the environment clean, we reduce the risk of transmitting infections. Standard precautions form the next component. This involves treating all patients as potentially infectious. Safe injection practices, proper handling of patient care equipment, and other infection control practices are integral to these precautions. For patients with known or suspected infections, transmission-based precautions come into play. This includes contact, droplet, and airborne precautions, each tailored to the mode of transmission of the infectious agent. Vaccination is another key aspect of infection control. Healthcare workers should be vaccinated against vaccine-preventable diseases. This not only protects the healthcare workers but also the patients they interact with. Surveillance and outbreak management play a pivotal role in infection control. By monitoring and reporting healthcare-associated infections, healthcare facilities can identify and control outbreaks and implement measures to prevent future infections. Last but not least, education and training. Ongoing education and training on infection control practices and policies are essential to ensure compliance and effectiveness. Knowledge is power, and in this case, it's the power to prevent infections. In conclusion, infection control in healthcare settings is a multifaceted approach that includes hand hygiene, use of personal protective equipment, environmental cleaning, standard and transmission-based precautions, vaccination, surveillance and outbreak management, and education and training. By implementing these measures rigorously, healthcare facilities can protect the health and safety of patients and healthcare workers, reduce the risk of transmitting infections, and promote positive healthcare outcomes. Remember, infection control is everyone's responsibility, and every action counts.